For more on Phase 4.1 of the Reopen Plan, I'm joined by Dr. Huang. She's a former Deputy Medical Health Officer in Saskatchewan and oversaw public health programs in the province for the past 5 years. Dr. Huang, I'm curious what you think of Saskatchewan's progress compared to other provinces. Everyone has categorized their phases quite differently.
I think Saskatchewan is middle of the pack compared to the rest of the provinces and territory in Canada. Most recently, our test positive rate, which is an indication of how much infections there may be in our province, was quite similar to BC. And as we've heard lots, BC is sort of beginning to reopen quite a bit as well. So I think overall, we've achieved the goal of flattening the curve.
Realistically, how soon do you think we could safely move into the second part of Phase 4?
Now, what's different between Part 1 and Part 2 of Phase 4, which I'm glad to see, is a delayed in opening up indoor-based recreational facilities. We know that in Phase 1, the business and workplace, which are indoors, are opened and restaurants can be opened. But I think the concern for me is that there hasn't been adequate emphasis on the risk of transmission for people who don't show symptoms and the benefit of everyone wearing face masks when participating in indoor spaces. So I do think that if people are cognizant of that and that we can increase the rate of people wearing masks while engaging in various activity indoor for prolonged period of time, I don't see why we couldn't open Part 2 of Phase 2, which includes, I think, theaters and movies a bit earlier, say in 2 weeks' time, once we have a bit of a sense of how Part 1 of Phase 4 is doing.
We had the first day of summer this past weekend. Kids are essentially done school. People will start considering interprovincial travel. When it comes to coming home from travel, right now people are just told to self-monitor for 14 days. Do you think there needs to be more specific guidance?
I would love to see more education from the public health officials on the risk of people spreading the coronavirus even before they show any symptoms. What we know now for sure is that there's a small subset of people who can become infectious and spread the coronavirus to other people, whether at work or at home, without ever showing symptoms. But a huge number of people who do become symptomatic actually ends up transmitting the virus before they even show symptoms. And so there has been various estimates, but generally we're looking at about 40% of the infection occur when the index case have not shown symptoms. What that tells us is that self-monitoring for symptoms isn't adequate. What that means is that if you become infectious and you go out and engage in an indoor activity that has 30 people around you for an hour or two, there's a possibility that you can be spreading that to other people, or other people can spread that to you. If all you're looking for is compatible symptoms for COVID-19. And that brings back the sort of emphasis I mentioned earlier about the benefit of a wider adoption of wearing face masks, especially in indoor enclosed setting where physical distance isn't possible or feasible. So I do think that if people come back from traveling, and particularly if you're coming back from Ontario, Quebec, or coming back from the US, for example, or being in areas where there are higher risk of COVID-19 than what we have here in Saskatchewan, ideally you want to avoid being in contact with others if you can for the 2 weeks. And if not possible, be very mindful of who you're coming into contact with and avoid being in contact with people who are high risk, immunocompromised, elderly. And if possible, get a test about a week after you return, because by that time, if you're going to show symptoms or if you're going to be infectious, the test should be able to pick that up around that time, about a week after you return.
Dr. Huang, thank you so much for your time.
You're welcome.
Dr. Ann Huang is a former deputy medical health officer in Saskatchewan. We reached her in Saskatoon tonight.